So when we look at our different medications, we're looking at anticholinergics, we're looking at beta-2 agonists, corticosteroids, we are looking at the methylxanthines, PDE, and I put an example of each. I always say, you know, it's really important that you try to at least remember one of each kind so that you can kind of identify, okay, it's this kind. And you do need to know what each of them do. So we know most of these are, or actually all of these are, what is it called? Long acting, right? And so they're the ones that we use for maintenance mostly, right? And they usually use them at night or in the morning, depending on what the prescribing doctor indicates that they need. But which one do they need for rescue? It's the albuterol. So which one do they use first if they are taking the medications? The albuterol, right? You always use that first because that's fast acting, and then you use the maintenance one to reduce what? Inflammation, correct. Okay, so here are some of the problems that we have. Again, all of these breathing issues have similar problems, even though they're being caused by different things, right? We talked about the asthma, we talked about pneumonia, now we're in emphysema and bronchitis, but all of them, yes, they're caused by different problems. You have to remember what the problem is, because that's what's going to tell us, in addition to the things that are similar, what else are we going to do that's specific to that problem. But here are the problems. There's a lack of deep breathing, poor oxygenation. So the lack of deep breathing, what is a nursing diagnosis that would be connected to that one? Ineffective breathing pattern, right? So the person is probably having shallow breaths, or so this is deep breathing, or they could have had the opposite where they're having, you know, too fast of a breath, right? Where they're hyperventilating, and that could be a problem too. But this one, mostly for them, it's going to be lack of deep breath, right? We have the congested airway, and it's congested because of what again? The mucus, right? It's congested because of the mucus, and so that's a problem. We want to clear the mucus. What would we do to help clear the mucus? Suction? Yeah, we could definitely suction them, right? If that's what it takes, if they can't cough it out, right? If it's too thick, what else could we do? We can give them mucolytics, right? To break it down. What else could we give them? Say it again. Fluids, yeah, right? When we think about if it's too thick, if anything, let's say your cooking is too thick, what you add water to it, make it thinner, right? The same thing. So, I mean, that's kind of a gross concept to think about, but we don't want to connect the two. Mucus and food, yuck. So yeah, but definitely you want to hydrate to help thin out the mucus so that they can cough it better, right? And we have poor activity intolerance. Why do they have poor activity intolerance? Not enough oxygen. Yes, not enough oxygen. Oxygen brings us energy. Energy is in our blood, and if they don't have enough blood flow or they're not breathing properly, the blood is not going to have oxygen. They're not going to have energy. So what will we do to help them with this poor activity intolerance? Yes, cluster care. What else can we do? They have a lack of oxygen. We can give them oxygen, right? So you'll see your patients sometimes like they're moving in bed and they're short of breath. So you want to give them some oxygen, right? But you definitely want to do some cluster care. You want to give them rest periods, right? Okay, poor nutrition. So why do they have poor nutrition? No energy. Yeah, same thing. They don't have energy to eat. They just want to, sleep, rest, and breathe, right? They because while you're breathing, when you're chewing, and you can't do both at the same time, right? So what do we do for those people? How do we help them? Small, frequent meals. Yes, we give them small, frequent meals. But what kind of meals do we give them? High calories. So at the time that they eat, we give them as much energy as possible, right? Difficulty with family coping. What's that one about? Yeah, they could be depressed, right? Because they're not doing the things that they used to. They're not playing with their grandkids or their kids. They're not able to go to work, right? They're the provider, right? That can be a difficult situation, because who's going to replace grandpa or dad with this now emphysema issue that he has, right? So now we're going to have to figure out, okay, do we need help? Who's going to take care of, who's going to stay at home, how are we going to manage, how are we going to get funding, how we, like, all these problems. So definitely difficulty in family coping. Then we have risk for falls. Why do we have risk for falls? No energy. Yeah, you get out of bed and then the energy, and there was this orthopnea that we saw, right? When the oxygen, right, oxygen is not rushing to your brain, it's rushing out of your brain when you stand up, right? Same thing with when they have, what is it called? The other one with blood pressure, it escapes me now. When we see hypertension, we'll see that. But yeah, when the oxygen comes out of your brain, you faint, right? You can pass out, or you can become weak. These people are weak because oxygen is energy. You need oxygen for ATP. Remember with chemistry? I seem to remember something like that, right? The Krebs cycle, all those things, right? Right, you need energy for that. But the other thing too, when we talk about the like possibility of a syncope, when you don't have oxygen in your brain, when a person passes out, right, and they fall, what do they call that? It's self-rectifying. Why is it self-rectifying if a person passes out and falls on the floor? So the brain was lacking oxygen as they stood, because the blood was flowing down. But when they lie flat, the oxygen, because of the blood, flows back to the head, and it brings the oxygen to the brain, and then they wake up, right? I always remember I had an experience with that, where it was undergrad. I was looking for some kind of chemical, something I hadn't eaten in microbiology lab, and I'm hunched over and I'm looking for this chemical thing, and I find it. It's like the eureka, like I found it. But then again, I was hungry, I was tired, I was bent over for too long. So when I got up, plus there were fumes, like the blood drained out of my head. Like literally it just started turning black, but it was like in slow-mo, because I was like walking to the door like, oh my God. And I remember it was just getting darker and darker. And as I got to the door, like I literally just started falling. And just as the light had started dimming, it was like this narrowing darkness like this. And then it started clearing up again the same way. It was like the weirdest feeling. I remember my TA, and I'm like telling myself, I'm dying. And my TA is like, Miss, no, Miss, you're not gonna die. He was a foreign student, and he was so terrified. He's like, I'm gonna lose my job. I just lost a student. Anyway, but I always remember that, like, because as the blood is rushing out of your brain, it becomes dark, no oxygen, you pass out, level of consciousness is changed. But once you shift position, if that's the reason why it's happening, my lying down on the ground, right, brought the blood back into my brain. So it's the same idea here for risk for falls, that and the energy that you don't have. Decisional conflict, smoking, right? It's hard to tell someone not to smoke. It's hard for someone to stop smoking, so we got to remember that. And we have to have a conversation that's empathetic, right? Understanding why they smoke and how we can help them stop. Not just be like, you should stop smoking, right? This is what's killing you, right? Like, that's not the way to do it. Okay, so thinking about nursing interventions, right? So all the things we were saying, we're elevating the head of the bed. Why are we elevating the head of the bed? Yeah, to help. See, I just mentioned, like, we got to lower the person for the blood to rush to the brain, right? And you're like, wait, but why are we elevating the bread? Why are we elevating the bed? Well, these are different reasons, right? You lower, if the person was passing out, they fall because they need oxygen to get to their brain. But in this case, we're elevating the bed because remember we mentioned surface area. If they're lying flat, then the lungs are like this. It's harder for all of this lung to expand, whereas when they're sitting like this, it's easier because gravity is not flattening it, right? Gravity is not pulling the whole thing shut, where it's already hard for them to expand in any way. So when they sit up, then gravity works down, so it's not impeding on the expansion. Do you see that? So that's why we're elevating the bed. Then we have the compliance with diet and nutrition. So we have to tell them to eat the right foods because they need energy and they don't want to eat junk food, chocolates, right? That's not going to really give them energy. But they also need to eat because even though they don't feel like eating, the food is what's going to give their body nutrients, is going to help them heal. Yes, it's not going to get any better, but we don't want it to get any worse either. Personal breathing, we teach them that, we said, because we want to help them expel the carbon dioxide, right? Breathe out the trapped air, right? It helps them, give them control. It helps make them feel better. Provide medication as ordered. We said we either can give albuterol if they're in, they need a quick fix because they're having trouble right now. So we want to give them albuterol. But if it's a chronic thing, they're going to be on corticosteroids, which helps with inflammation. Learn techniques to expel mucus. So I kept saying the half coughing, right? That, and just, let's see what else. That's usually mostly what it is, how to cough to help them with the mucus, right? But also learning you need to drink more water, that kind of thing. Rest periods to conserve energy. So that cluster care. So these are things that we're teaching them, we're telling them, and these are interventions that we are implementing as well. Okay, so you have a case study. I have uploaded it under this week. So go to the week and it says the case study, 60-year-old female presenting with shortness of breath. So I want us to read and we're going to talk about it, right? We're not going to answer questions, but I'm going to ask you, so what are you identifying and all of that? Just read as much as you can and then we'll get to the case study.